Sterilization. Process by which all forms of microbial life including bacteria, viruses, spores, and fungi are completely destroyed. Sterilization. Process by which all forms of microbial life including bacteria, viruses, spores, and fungi are completely destroyed. Cleaning of items is the first and most important step in any sterilization or high-level disinfection process. Items should be cleaned until no visible tissue residue, fluid, or soil remains on them. Excessive moisture must be removed from items before they are disinfected. Disinfectant solution can be diluted by water and it is unable to kill certain microorganisms within the recommended exposure time. Effectiveness of disinfectants depends on several factors including type and amount of microorganisms, contact, time, temperature, telephone water quality, device material, positioning of device. Effectiveness of disinfectants depends on several factors including type and amount of microorganisms, contact, time, temperature, telephone water quality, device material, positioning of device. Spalding classification. Earl Spalding of Temple University in a 1939 paper on disinfection of surgical instruments in a chemical solution 1. Proposed a strategy for sterilization or disinfection of inanimate objects and surfaces based on the degree of risk involved in their use. 2. For the medical community. Semi-critical items. Mucous membranes, high-level disinfection. These items come in contact with intact mucous membranes. They do not ordinarily penetrate body surfaces. Flexible endoscopes, endotracheal tubes, anesthesia breathing circuits, and cystoscopes. High-level disinfection kills all vegetative microorganisms, tubercle bacilli, most fungi, non-lipid and small viruses, and lipid and medium-sized viruses with the exception of high numbers of bacterial spores. Quaternary ammonium compounds. Low-level disinfectant, cationic, incompatible with soap, denatures essential cell protein and disrupts cell membranes. Environmental sanitation of non-critical surfaces such as floors, walls, and furniture, not the disinfectant of choice for use in central service. Phenolics. Intermediate to low-level disinfectant penetrate cell wall and precipitate cell protein. Residual activity, agent of choice for housekeeping services. Phenolics. Intermediate to low-level disinfectant penetrate cell wall and precipitate cell protein. Residual activity, agent of choice for housekeeping services. A. P. A. orthophthaldehyde. 4. 'High level equals 8% formaldehyde plus 70% alcohol. Intermediate level equals 4% to 8% plus water. Kills by alkylation. Formaldehyde. Martensitic stainless steel. Also known as 400 series stainless steel. It is magnetic and may be heat hardened, used to make scissors, osteotomes, chisels, needle holders, forceps. Austenitic stainless steel. 300 series stainless steel, non-magnetic, cannot be heat-hardened, and is more corrosion-resistant, more workable and malleable retractors, cannulas, rib spreaders, suction devices. Passivation. Chemical process applied during instrument manufacture that provides a corrosion-resistant finish by forming a thin transparent chromium oxide film. Uses nitric acid to remove all the iron content still found on outside layer. Sharpness testing, laparoscopic scissors. Single-ply facial tissue. Sharpness testing, bone cutter Kerrison Ronger laminectomy Ronger, double action Ronger. Index card. Sharpness testing, bone curette, chisels and osteotomes. Plastic dowel rod. Sharpness testing, laparoscopic scissors. Single-ply facial tissue. Sharpness testing, bone cutter Kerrison Ronger laminectomy Ronger, double action Ronger. Index card. Sharpness testing, bone curette, chisels and osteotomes. Plastic dowel rod. Sharpness testing, bone curette, chisels and osteotomes. Plastic dowel rod. Tray assembly tips. Heavy instruments on bottom side, adequate space for weight distribution, curves in same direction, forceps softly nested together, delicate instruments in micro cases. Use a stringer. Lumen. The interior path through a needle, tube, or surgical instrument. Types of electric powdered surgical instruments. Electric pneumatic battery. Advantages of air. Time cleaning, consistent exposure to agents, time contact with agents, use of air flush cycle, use of copious and consistent amounts of water. Leak test. An endoscope processing procedure that ensures the device's flexible covering and internal channels are watertight. Six basic steps are required to clean and reprocess endoscopes. Pre-cleaning, leak testing, cleaning, high-level disinfecting, sterilizing, drying, storing. Steps for reprocessing rigid scopes. Clean, inspect, high-level disinfect, sterilize, inspect. High-level disinfection and sterilization, rigid/semi-rigid scopes. High-level disinfection is recommended only for telescopes that come into contact with mucous membranes. Sterilization is recommended for telescopes to be used in any laparoscopic, arthroscopic, OB/GYN, plastic, reconstructive, or aesthetic surgery procedures. Prion. Virus-like infectious agents that cause a variety of neurodegenerative diseases in humans and animals, including scrupy in sheep and goats, bovine spongiform encephalopathy in cattle, and Creutzfeldt-Jakob disease in humans. Seals tamper evitnet. Sealing methods for sterile packaging that allow users to determine if the packaging has been opened. Two categories of sterility packaging: reusable, disposable. Objectives of packaging process. Allow penetration of chosen sterilant. Maintain sterility of package contents. Allow for being opened aseptically. Disposable sterilization materials. Pouches, non-woven wrap. Muslin. Wide variety of plain weave cotton or cotton polyester fabrics having approximately 140 threads per square inch. Packaging used for steam sterilization. Must be capable of withstanding high temps of 250-270-275, must allow air removal and steam penetration, and must permit drying. Packaging used for dry heat sterilization. Must be able to tolerate 2 to 3 hours of 320 to 400 degrees. Packaging used for gas plasma. Must be able to tolerate deep vacuum draw without absorbing the sterilant. Rigid container system. Instrument containers that hold medical devices during sterilization and also protect devices from contamination during storage and transport. Wet pack. Containers with moisture after the sterilization process is completed. Spunbin polyolefin plastic SMS wraps. Used for gas plasma sterilization, referred to as Tyvek pouches, contains no cellulosic material, therefore compatible with gas plasma hydrogen peroxide. Wicking material. Unapproved absorbent material that allows for air removal, steam penetration and facilitates drying. Packaging materials should be held at room temperature 64 degrees Fahrenheit-72 degrees Fahrenheit, humidity ranging from 35%-70% for a minimum of 2 hours before sterilization. Wrapped pans of instruments should not exceed 16 pounds. Containerized instrument sets should not exceed 25 pounds. Sterility event related. Considered sterile unless the integrity of the packaging is compromised or suspected of being compromised by an event regardless of expiration date. FIFO. First in, first out. Three agencies that have established standards, guidelines, and recommendations for IAS. ALMA-IARN Joint Commission. Flash eye cycles. Gravity Pre-Vacuum Express. Common ice exposure times 3, 4, 10. Preset express cycle 4 minutes at 270 degrees Fahrenheit with 3 minutes drying time, total cycle time of 12 minutes. Pre-vacuum load of mixed materials or items with lumens 4 minutes at 270 degrees Fahrenheit. Pre-cleaning is the most important part of the decontamination process. Up to 99% of microorganisms on an instrument can be removed with thorough cleaning. Biological indicator. Sterilization process monitoring device consisting of a standardized viable population of microorganism spores known to be resistant to the mode of sterilization being monitored. Incubation temperature for Geobacillus standardomophilus is 122 degrees Fahrenheit - 140 degrees Fahrenheit. Residual air removal test, Bowie-Dick test class 2. Test for sterilizers with a pre-vacuum cycle checks the efficiency of the sterilizer's air removal system during the pre-vacuum cycle to detect inadequate air removal or air leaks in the chamber. Critical devices. Introduced directly into the bloodstream or other normally sterile areas of the body should undergo a sterilization process. Conduction. Transmission of heat from one part to another part of the material. Important factors for sterilization. Type of microorganisms, number of microorganisms, amount and type of soil, amount of protection device provides. Advantages of steam sterilization. Cheap, fast, simple, no chemical residues. Types of steam sterilizers. Tabletop gravity air displacement, dynamic air removal, steam flush and pressure pulse, flash, instrument washer sterilizer.